This is the last screencast for the class. This course doesn't go too much into the treatment of addiction and touches slightly on the psychology of addiction, but honestly, I don't think the book does a very good job of summarizing this. So there are several other classes that you can take at Nova to deal with this, and I would encourage you to take those classes, more like therapy and treatment-oriented classes. But here we're going to talk a little bit about the psychology and physiology of addiction. And then there is a film attached to the Blackboard portion of the class called Addiction. It's an HBO documentary. It's an excellent documentary dealing with this. This is kind of excerpts from the documentary. This is based on a piece written by Nora Volkow from NIDA, the National Institute of Drug Abuse, called Addiction in the Brain's Pleasure Pathway Beyond Willpower. So we're going to talk about this a little bit. I wanted to highlight this. If you go to the HBO addiction website, there's all sorts of resources there. It's really a great tool, and after you watch the video, I'd encourage you to check out the website. And this piece that the screencast is based on is directly from there. So the first thing that we want to talk about is that a lot of people think that addiction is like a character defect or flaw, and that is a myth. That is not true. Addiction can develop regardless of a person's best intentions or characters. Nobody starts using drugs because they want to have a substance abuse problem. That's not a reality. People use drugs and they think that they are oftentimes immune to the negative effects or potential addiction or dependence or abuse, but that's not true. Repeated drug use disrupts the functioning of the brain. We're going to talk about that in detail. I mean, there's a lot of other psychological theories. Really, we could spend months and months and months on this, but we don't in this class. But I'd like to just give you the best, like, up-to-date psychological, physiological interaction theory of addiction instead of going over some of the older theories that aren't supported by research. So when we're looking in the area of addiction, what we're really doing is looking at the brain. The brain is an incredible machine. So you've got, I mean, the estimates are that from 2 to 10 billion neurons. Each neuron will have between 1,000 and 100,000 connections with other neurons. It is extraordinarily complicated, and that jelly mass in our head gives rise to everything that we do: our thoughts, our emotions, our perceptions, and our drives. Any of these drugs that are addictive are all psychoactive drugs. That means they're having an effect on the brain. Most times people take a drug to feel good for some reason, or potentially to relieve stress. That's pretty common. But after a short period of time, that choice to take the drug is gone. And that's a very important concept for you to understand. Yes, a person might make the choice to use a substance in the first place, but after that, their free will is usurped by the drug itself, by changes in the brain. Why does this happen? What is going on? How do these drugs have that much power? Well, there's a couple things that are going on. The first thing is that most drugs don't really cause brain damage like we think. Now, that's a little different if you talk about like a pregnant mother and a developing fetus, but what they do is they change the functioning of the brain. And this change in functioning can be lifelong. And eventually, the drug use can come to replace normal things in that person's life, like food, relationships with other people, things that they used to do for fun. And that desire for the drug can become like a one-track mission to seek out and eventually use a drug. So here's how this can typically happen. This is just an example. A person takes a drug of abuse, whether it's like marijuana or cocaine or alcohol, whatever it might be, And these drugs activate the same brain circuits as do behaviors that are directly linked to survival, like eating, bonding with other human beings, sex. All of these behaviors trigger activity in an area of the brain called the mesolimbic system, or the central reward pathway. These behaviors cause a surge of dopamine, the neurotransmitter, in those areas. Dopamine results in feelings of pleasure. All drugs of abuse, all of them, either directly or indirectly increase dopamine levels. The brain then remembers that pleasure, and the orienting response of the brain is to desire that pleasure again in the future. That's like what a craving is. It wants to repeat it. So not only do like these things like eating, bonding, and sex increase the levels of dopamine, a lot of the drugs will increase it to that level and then well beyond. And it's just a flood of dopamine in the reward pathways. So just as food was once linked to day-to-day living, like you need to eat to live, and our ancestors sure needed to eat, drugs begin to take on the same significance for the drug addict. So physiologically in the brain, the drugs become just as, if not more important than basic things needed for living, like food, or bonding, or sex. The need to obtain and take drugs becomes more important than any other need. The addict no longer seeks the drug for pleasure, but for relieving distress. So think about withdrawal. All drugs in withdrawal basically do the same thing that they do when they're active, and you need to get out of that state of distress. That's what we call like a negative reinforcer. So at first the drugs work as a positive reinforcer, but a negative reinforcer is relieving an adversive stimulus. So like when you got in your car this morning, I'm sure that seatbelt noise was going bing, 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 bing. That's really annoying. That's the distress part. And the easiest way to get rid of that distress is to put on your seatbelt, or when an addict is in withdrawal, it's just to take the drug. So eventually the drive to seek and use the drug is all that matters, despite potentially devastating consequences of drug use. So finally, control and choice in everything that once held a value in a person's life, like their family, their job, community, all of that is lost to the disease of addiction. What brain changes are responsible for such a dramatic shift? Well, we highlighted this a little bit. But the major thing, and this is all from research, so research has really advanced our knowledge of addiction and how addiction works. And addiction is a disease of the brain. So there's a handful of changes in how the brain works. The major ones include reduced dopamine activity. So when we take drugs, our brain releases that dopamine and releases that dopamine. And that dopamine is there for us to feel pleasure and to motivate our behavior towards the natural rewards that we would receive in everyday life, like, you know, food or relationships or whatever it might be. Drugs produce that very large and rapid dopamine surge, and the brain responds by reducing normal dopamine activity. So remember, the body wants to achieve balance or homeostasis. So if you're introducing a bunch of dopamine by taking illegal drugs, either directly or indirectly increasing levels of dopamine, this eventually disrupts the system and renders the addict incapable of feeling any pleasure, because their brain compensates by reducing the dopamine activity in the mesolimbic system. Eventually that gets so disrupted that addicts are incapable of feeling any pleasure from even the drugs that they seek to feed their addiction. Now, drugs also alter brain regions that control decision making and judgment. Drugs of abuse affect the regions of the brain that help us control our desires and emotions. So this lack of control leads addicted people to compulsively pursue drugs even when the drugs have lost their power to reward that individual. So, I mean, if you see somebody in the depth of an addiction, I mean, that drug use is not fun for them. That's why that happens. So the disease of addiction can develop in people despite their best intentions or strength of character. Drug addiction is insidious because it affects the very brain areas that people need to think straight. So these are like frontal lobe skills. These areas allow you to apply good judgment and make good decisions for your life. No one wants to grow up to be a drug addict. No one starts using drugs thinking that they're going to become a drug addict. However, the drugs hijack the brain. It's not unusual for an addicted person to be addicted to alcohol, nicotine, and illicit drugs at the same time. So we call those comorbid addictions or poly addictions sometimes. But nobody typically comes in with just one drug of abuse. Typically it's a whole host of problems, and they're addicted to multiple substances. And this really increases the level of suffering and managing the associated costs to the individual, to society, to their health as a whole. All these drugs, no matter what the drug is, all drugs of addiction, they have one thing in common, and that is the ability to hijack the brain's central reward pathway, the route to pleasure. Okay, now, if we're looking at treatment, there's a couple things that we can do. We can use medications, like naltrexone, which can help in heroin addiction. We can combine medications with behavioral therapy. This has been shown to be the best treatment option. We can use a multiple approach. This is what I like. So I like to call this, it's not my term, but it's called the systems approach. So from the cellular level all the way up to the societal level, I think that we should really look at all the persons that someone with an addiction has, all the problems, and treat all those problems simultaneously. So a lot of people with addiction will have comorbid psychiatric disorders like depression or anxiety, maybe a history of trauma, and that can put someone at risk for relapse. So we need to consider all the aspects of that person's life, not just psychiatric disorders, but maybe their marital status, their employment status, housing, financial status, things like that. Anything that we can do to help put that person's life back together, we need to tackle all of those co-occurring conditions at once. Now, relapse is part of an addiction. So relapse is a rule, not the exception, and a lot of people don't realize that. And despite having lots of forms of treatment available, people frequently relapse from drugs. And that's what the brain does. So watch that video and you'll see the science of relapse. The changes that happen in the brain are accompanied by intense drug cravings, even if people have been abstinent from the drugs for years and years and years. So relapse happens at a really high rate. So again, addiction is like a chronic disease. And just like an asthma attack can be triggered by smoke, or a person with diabetes can have a reaction if they eat too much sugar, a drug addict can be triggered back to return to drug abuse. And we should think of addiction as a chronic disease requiring lifelong treatment. So in order to achieve recovery, treatment must be addressed specifically. Individual patient needs must be taken into account. It's not good enough just to get off drugs. It really is necessary to address all the relevant problems in the person's life. We'll continue here with part 2, which will be very short.